Welcome to Gunbalanya, otherwise known as Owenpelly. Gunbalanya is just 15 kilometres away from the world-famous Kakadu National Park on the Arnhem side of the East Alligator River. Gunbalanya is 300 kilometres southeast of Darwin. Gunbalanya sits at the base of the Kakadu National Park escarpment and is a traditional homeland of the Mungalun people. The people of Western Arnhem Land are called Binning.
Gunbalanya is a beautiful land where it's nearby Billabong, all around the plain and the tree. I see the birds are flying around the Billabong, and I see the horse and the cattle standing on the plain. Gunbalanya, the rock of the three brothers. Harkulok, inyalang nimbapir. Gunbalanya, the rock of the three brothers. Harkulok, inyalang nimbapir. Harkulok, inyalang nimbapir. They all have a dream.
Hello, my name's Hugh Heggie, and I have been a medical practitioner for 35 years, a pharmacologist before that, and I did general practice in Victoria for 25 years. And I found myself looking at some advertisements for positions in remote Australia. I came on a camping holiday to Central Australia and found it felt like a homecoming experience. So I returned the following year. We came with 4 of our 6 children to a remote community about 300 kilometres from Alice Springs. I came feeling a bit nervous because I was anxious about my emergency skills, but the medical advisor from the GP network assured me that most of the work I would do would be in chronic disease, and that's what it has been. And the emergency skills, I would get support through training and also telephone support, and that also has been the case. And importantly, I have been a member of a team, and all of those team members bring their own skills, the nurses and the health workers, and practicing a lot of really worthwhile medicine. I felt like it was meaningful practice. In my time in the Northern Territory, I have been to a number of communities. After the 3 years in Central Australia and another year in another community there, came to the top end and went to Gunbalanya or Owenpelly, which is in West Arnhem Land, near Kakadu National Park. The time I've spent in Gunbalanya or Owenpelly has been fantastic. I thought it might be challenging because the reality is that for 2 months of a year, because of the wet season, you can only travel about 5-6 kilometres from the community by road. And I went there choosing that location because that team of people had a reputation for teamwork with the health workers and nurses, delivering a range of programs, some of which the network facilitate, and also through the Department of Health and Families, and across a range of areas, including the acute medicine, the emergency medicine, but also child and maternal health, chronic disease, mental health, and unusual things that I hadn't been involved before, such as rheumatic heart disease programs and community health issues. Things like sometimes substance abuse.
Yeah, my name's Leon James. I'm the alcohol and other drug worker Based at the clinic here at Gunbalanya. My position is employed through remote alcohol and other drug workforce, was based in Alice Springs. I've been here in Gunbalanya now since April 2009, with just around 18 months.
I'm Mark Hanson. I've been an Aboriginal health worker for about 18 years. Worked around the communities, 6 years at RDH, and well, 5 years here now. So finding it interesting and on call and dealing with some emergencies when they happen.
We also need to be thoughtful and sensitive, and one of the sensitivities is around the person's culture and acknowledging their culture and their cultural beliefs and learning from them. I've learnt a lot of interesting things, historical things, bush medicine, bush tucker. Because of that, I've also developed strong friendships with people. I feel that myself and my family have been part of a community, and that's why it does not feel isolated, because you are part of the community and you take part in community activities. There'll be challenges of language, perhaps. For me, it's Aia Makijbu, Nakamaran Irja, Nakoban. I'm telling you that I'm the witch doctor at the community, that my skin name is Nakamaran and moiety Irja moiety, and I'm Nakoban, old man with respect. There'll be the opportunity to perhaps travel away from the community to outstations, sometimes by road, beautiful country, sometimes by small aircraft, and visit people who are living at small outstations in Arnhem Land. I'd encourage people to consider coming to the remote community, Indigenous community in the Northern Territory, because it is exciting and challenging, but you are well supported, access to courses, support, being able to contact specialists on the telephone to get instant guidance. The teams in remote sites I am involved in often because I do some of the telephone support and facilitate evacuations. Because I've been out there, I know what it's like. I'd encourage you to come and give it a try.
$1 bill, the one we had, $1 Australian brown dollar note from that last decade, and then they put them all together and then they developed, it's like an Australian dollar note.
Good to have a doctor here permanently for a while, a few years.
Very good day, mate. Yeah. Good football match. Work at the clinic with all these lovely people.
I tell them that, you know, Jimmy Little is, but I just tell them that I can't sing like him, that's all.
That's funny.
I feel like I'm practicing meaningful medicine every day.